Hi Lisa, my name is Jen. I'm going to be the student nurse with you today.
Hi Jen, welcome.
Hi, do you mind giving me SR report on your patient?
Sure. Okay, I'm taking care of Ronald Jarvis. He's in room 622. He's a 67-year-old male that came in from his doctor's office with a stage 2 diabetic ulcer on his right heel. It has moderate serosanguinous drainage. We are cleaning it twice a day by irrigating it with norsaline and applying a dry dressing. He's a type 1 diabetic. He's a full code. He has no allergies. He does not smoke. He only drinks about a beer a week. He's awake, alert, and oriented times 3, pupils equal, rounded, and reactive to light and accommodation. He does have diminished sensation in bilateral lower extremities. His lungs are clear to auscultation. S1 and S2 heart sounds are heard, regular rate and rhythm. He has normal active bowel sounds. He voids by himself. He gets up as tolerated. His last blood sugar at 8:30 p.m. was 242, and that was capillary blood sugar. His vital sign at 16:45, his blood pressure was 128/70, respiration 16. The pulse ox was 96. And we're here to treat his elevated blood sugar.
What medication are we going to be giving
We're
him?
going to be getting him his Lantus, which is long-acting, and regular, which is short-acting,
Why specifically is this client receiving this medication?
because his blood sugar is high.
What action does the medication have on the body?
It acts by stimulating glucose uptake in skeletal muscle and fat.
When should you question administering this medication?
If he shows signs of hypoglycemia, I would go ahead and check his blood sugar again first before administering it, and the signs are, sweatiness and shakes.
Does the medication have a therapeutic serum level?
Yes, between 60 and 100.
Which vital signs must be monitored?
Blood pressure, pulse, respiration, and pain.
Which physiological parameters should be monitored when the medication is being administered?
I want to make sure that he doesn't show signs of hypoglycemia, the diaphoresis and the shakiness, tremors.
What interventions must be taught to the client to ensure the medication is administered safely in the hospital setting?
To make sure that he lets us know if he shows any adverse effects, with hypoglycemia.
What interventions must be taught for taking the medication safely at home?
I want to make sure that he has his own glucometer and that he has a Sharps box. He knows to rotate injection sites on a weekly basis and to check his blood sugar regularly and report any adverse values if they go on more than 3 times, those low and high values.
What are the side effects and potential adverse reactions?
The hypoglycemia, which is the low blood sugar, sweating, diaphoresis, and shakiness, and hyperglycemia is he could be confused and agitated.
How will you know the medication is effective?
By maintaining therapeutic levels.
All right, thank you.
Okay, let's go in the room. Knock, knock. Hi, Mr. Jarvis.
Hi.
Hi, can you tell me, my name's Lisa. I'm your nurse today, and I have the student nurse with me as well.
Hi.
Jen. Okay, can you tell me your name and date of birth?
It's Ronald Jarvis, and I'm 67 years old.
And do you have any allergies?
No allergies.
Alright. I'm going to wash my hands. We're here to give you your insulin, okay? Alright, so right here I'm going to go ahead and reestablish the connection to the server because it was dropped. But I see on your chart you don't have any allergies. Alrighty, and this is Ronald Jarvis. We have the Lantus, which is routinely scheduled at 18 units. So I'm going to start with that one first. So I'm going to go ahead and put your name, ID in the computer, okay, for the Lantus. Do you mind reading me his ID, Ben, for Ronald
Sure.
Jarvis? And how old are you again, sir?
I'm 67 years old.
Okay, great. And the code?
It's 953 655
Yes.
5296.
Okay, and then, so for the Lantus, doesn't expire. It's 2020. So I want to make sure right drug, which is Lantus, right time, which is 2100, right dose. We're giving at 18 units. Right patient, which is Ronald Jarvis, and I'm going to be giving this at sub-Q, and I looked it up in the drug manual, and it says that's fine to give sub-Q. So right now I'm going to be scrubbing the hub. Lantus, 15 seconds. I'm going to drop 18 units of air. Okay, I'm going to inject it in here. 18 units of air. I'm going to turn it upside down, and I'm going to do draw 18 units. Okay, I'm going to single-handedly recap. Okay, Jen, can you make sure that's 18 units?
Yep, 18 units.
All right, I want to go ahead and do this barcode 9. Okay, so we have the greens. We're okay to give the 18 units of Lantus. Okay. All right, I'm doing the right lower quadrant. There, goes in the needle box. Okay, I'm going to come back here. Time administered was 2100. Right lower quadrant of his abdomen. And my initials, so I'm going to save that. Okay, the next one we're going to do, which is a sliding scale for his blood sugar, which was 242. It says here, if we hover over this, right here, Jen, 242, supposed to get 16 units of regular insulin, okay?
All right.
Do now? Oh. Okay, so for the regular insulin, we're going to go ahead and enter his ID again. Can you read it to me?
Yes, it's 953
Yep.
655 5296.
Okay. And I have regular insulin here, regular insulin, right dose, right drug, right patient. Mr. Jarvis, no allergies. No allergies, Mr. Jarvis expires 10/10/2020. So the medication is D9C 9C87B 90A4. Okay, see, we have the green light. See?
All right.
Okay, so for the sliding scale, we're going to give 16 units of regular insulin. So I'm going to scrub the hub. Draw 16 units. Air. And I'm going to withdraw 16. single-handedly tap it. Okay, there's 16 units, correct?
16 units.
Okay, and this medication I checked it is okay to give CQ. All right, we're going to go in here. Okay, I'm going to give you your regular insulin. We gave it because you have a sliding scale of 242 and it told us to give 16 units of regular, okay? Okay, now Mr. Jarvis, this goes in the sharp spots. I'm going to give you a quick little teaching. I'm going to let you know about the signs and symptoms of hypoglycemia. So when you get home, you need to, if you start getting shaky and sweating, you need to check your blood sugar, okay? And if you start getting agitated or anxious or confused, you need to check your blood sugar, okay? It's very important. You have a meter at home, right? A glucometer?
Yes,
Okay,
I do.
Good. And so do that. Check your blood sugar like your doctor told you to, Make sure your tray is right here. I see it right down there, so I'm going to make sure that you get to eat right now since I gave you your insulin. There's a diabetic management manual. It goes in more in detail what I just talked about. It also has stuff about your diet. Gives you better food choices, okay? So I'm going to go over here and document that I gave it right lower quadrant. The minister time was 2100. And then I gave the CBG was 242, so 16 units. Regular insulin was given in the right lower quadrant of the abdomen and my initials. So I'm going to save this. Okay. Then I'm going to make sure your call bill's within your reach. I'm going to go ahead, use those away, wash my hands again. All right, is there anything else I can do for you today, Mr. Jarvis?
Nope, that's it.
Okay, wonderful. How about you? You have any questions?
Yes, I do.
Jen?
Were there any pertinent pieces of information you reviewed before administering the client the medication?
I made sure that his blood sugar was accurate at 242.
Did this information affect your decision to administer the medication?
Yes, I had to, I did it as per the sliding scale as well.
Did this information affect how you administered the medication?
Yes. I went ahead and I administered in the right lower quadrant like it was ordered because of the capillary blood sugar being elevated.
All right, thank you.
Okay, thanks. Let's go chart.